Marsden, and welcome to GBMC's Ask the Oncology Expert. Today we are happy to have with us Lolly Forsythe-Chisolm, who is a mind-body therapist with integrative and palliative medicine at GBMC. Lolly, thank you so much for being with us today.
Thank you so much for inviting me.
So let's just start out with telling us what you do as a mind-body therapist.
Right. So my job on the team is to introduce relaxation techniques for patients, family, and staff. And a mind-body session really works collaboratively with the patient to encourage creating a self-care toolbox that helps during challenges of diagnosis and treatment.
So let's just talk about the type of patient, the type of individual you work with, and these are all cancer patients?
That's correct. Yeah.
Various types of cancer in various stages?
Definitely. Yeah, all types, all through the Cancer Center here at GBMC, different stages, sometimes just new diagnosis. Sometimes I'll get patients who are just starting radiation treatment, and sometimes patients in survivorship.
I get the sense that almost every patient would come your way at some point. Is that accurate?
Well, I think that's the goal. Since I'm just one right now, a referral comes through the doctors, nurses, and nurse practitioners, as well as the PAs. So right now I'm doing it on a referral basis. I agree with you, though. I think we all need different techniques and tools for resilience, for sure.
So as you know, a lot of questions that are put forth to you today as part of our conversation were actually asked in advance by either patients of yours or patients who are interested in learning more about mind-body therapy. So I want to get to all of them because everyone is listening and they want to hear the answers to their questions. So it starts out pretty broadly, and that is just sort of explaining, and I know this is probably very individual, but in general, what happens during a mind-body appointment?
So in a session, I'm going to check in with the patient, and I start by checking pain, anxiety, and stress scores. And that gives us a good idea to find out, where the challenges are, what's really going on. And from there, I explain and customize different techniques and tools using guided imagery, expressive arts, yoga breathwork, as well as mindset techniques that really customize to, like you said, very individually what's presenting, what's going on for the patient.
And I would imagine that for a lot of patients, especially of a certain age, a lot of what you practice and promote is relatively new to them.
Yes, definitely relatively new. And for that reason, I always check in what techniques they already use. And sometimes people have been doing a version of these, like guided imagery. They do peaceful place, or they've used music and prayer as really amazing ways to navigate and manage other life challenges. So it's really knowing that you can bring that into this session and continue using that, maybe with more intention of targeting, say, pain, anxiety, or other symptoms.
And do you start out by really trying to relate to how the mind does affect the body and vice versa?
Right. That's always in the first session to explain that, because sometimes we get feeling that our anxiety, we shouldn't have it. And so to just normalize and say, of course you're going to have anxiety with such a challenge in front of you. And a lot of times patients arrive with stories of what they know happened to someone else. And it really is addressing that those are normal reactions. And once we welcome that in, as normal, then we can label them and say, of course, anxiety and stress is going to be here. We're never going to eliminate that, but we can change our relationship to that using the techniques.
So you first give people sort of permission to feel what they're feeling. That's okay.
Yeah, for sure.
Who can benefit from mind-body techniques?
I think anyone can, like we kind of mentioned in the beginning. I think anyone can, But I'll tell you some really amazing ways patients have used it. It's really preparing for a procedure, sometimes preparing for the radiation, having to hold still during radiation times is difficult. Um, Also, really navigating sleep, and that's something we could all use, making sure you're getting the most restful sleep.
So because of who you're actually working with, you yourself must have to know a lot about what happens during treatment for cancer.
For sure, yeah. And so I have experience with working at University of Maryland for 10 years, University of Maryland, the Maryland Proton Center, and then shock trauma, as well as the Cancer Center at University of Maryland before I came here to GBMC.
And what patients have access to this type of treatment?
So patients who are getting care for their cancer treatment, and their doctor can put in a referral for a mind-body session.
And we just had this question come in, so I want to get it in because I know this person is watching. If a patient has been recently diagnosed with cancer, how can you help them manage their fears? The fear, especially that they won't be there for their family, which I'm sure is very common.
That's a very, very common one. And so fears are going to be present, like I said. And it really is beginning to do what I call notice, allow, and shift. And that's notice what feeling is there, what feeling is present, allow it by listening to the message, and then shift into peaceful pause. So in that like 3-word focus, you have the space of where you can allow it, because what happens is oftentimes we want to push away, and that's valuable energy that I want patients to understand they can use as a resource for their relaxation. So noticing allows us to name it. Once we name something, we're in a different place to go into hearing the message. This is signifying something that's very important to you, family, and staying with family. Recognize it's connected to a value, and then shift into peaceful pause using a technique like a body scan, a technique like light acupressure, as well as sometimes meditative walking and other expressive arts techniques to really move through noticing, allowing, and then shifting using a technique.
And the shifting part, I mean, obviously the first part of that is important to get to the shifting part, but the shifting part definitely seems like something you need to teach.
Right, and that's where the techniques and the mindful processes come in, and we practice those. The first one being always a body scan. So a body scan is where you start with breath work. So you're going to take that nice full breath in, all the way in, and nice slower exhales. That starts, and then you go into relaxing the muscles of your face, then down through your neck and across your shoulders. You get the idea. So we're going slowly through relaxing every body part. And some patients like to imagine that, and some patients like to just, visualize or kind of scrunch up their face, move their shoulders when they get to their shoulders. So there's different ways to do it that match our sensibility, but what that does is quiet thought. We think we can wrangle our thoughts to be quiet. We can't. They're there for a reason, and so the technique is what helps us slowly go down stepwise. And after the body scan, you're going to go into peaceful place. So that's another place to customize it, because your peaceful place is going to be different from mine. Or sometimes you can go into prayer, and you can see the benefit already of quieting your mind first and then going into peaceful place, which can further soften and relax your body.
So
really,
often we
yeah.
hear, sorry to cut you off, so often we hear about breathing as a way to manage anxiety, which brings us to a question that someone just poses. Isn't just breathe considered a cliche?
It absolutely is, and that's the unfortunate thing because then we tend to overlook it. And it's a very powerful process. And the powerful part of just breathe is when we take that full breath in and that longer exhalation. So you might take a breath in, an inhalation to the count of 4, and then try and extend it slightly. That's what activates the relaxation response. And that also acts similarly to the body scan if we're focused on the sensations of our breathing, sensations we normally take for granted, the rise and fall of our chest, the subtle sounds, then we're in the present moment. And the present moment is also a cliche, but the sensations are doorways to that present moment. For example, if you're listening, you're also in present moment because you stop for a minute and you're really in that sensation place. And that's what helps with relaxation and recognizing where your attention and your thoughts are.
And someone else wants to know, is there any evidence that mind-body therapy helps cancer patients with pain, stress, or anxiety?
Absolutely. All of these techniques are proven techniques. And that's the fun part. There's all kinds of studies you can look into, books that have talked about it, and more evidence is showing because we can see the way the brain is working. The functional MRIs have shown the different parts of the brain that come online when we come away from the stress response.
Someone wants to know if a mind-body session is considered a form of therapy, and I'm not really sure what they're getting at here, if they mean a therapy like cognitive therapy or physical therapy, or
Right.
it sounds like it is another tool in the box, right?
Yeah, it's definitely a tool in the box, and I get that question a lot. And I consider mind body sessions as educational guidance. And it's not therapy, but it sometimes works well in really highlighting where therapy might be beneficial. For example, if we're working through the anxiety that one of the callers mentioned, and it just keeps coming up. It comes coming back, or there's some sticky, challenging thoughts that keep coming in. It might be mind body sessions sometimes highlight that so that a patient can say, okay, I do need to pursue the support of a therapist. And there's phenomenal resources to encourage patients to do that. And then when they're with the therapist, they can still continue doing their mind body techniques to support that further growth.
It sounds like in many ways your goal is to get them to a point where they can practice on their own,
Yeah,
recognize what's happening in their body, and practice the techniques that they've learned through you.
right, right. Because I want them to be able to do it when they're laying on the table in the radiation room, for example, or at night. And
Yeah.
the body scan is a phenomenal tool at night. And I have a playlist that I can send them that has the recording of the body scan, but I rather have them have it at the ready rather than reaching for their phone. That's not always practical.
And is this part of guided imagery? Someone would like to know what exactly is guided imagery and how it can help in times of deep pain.
Right, that's a great question. And guided imagery is using your imagination with visualization to encourage calm, encourage resilience, or like I said, to really encourage that deep, restorative sleep. And so guided imagery, people wonder, well, I'm not a great, for example, sometimes patients say, I'm not great at imagining. I can't visualize well. But we notice anxiety, when we're in anxiety, we're oftentimes visualizing worst case scenario. So guided imagery really can leverage that and use that in your favor and switch it over to imagining different scenarios, peaceful place, using the body scan. So it really can connect in. Sometimes anxiety is that heightened imagination of what could go wrong.
Can mind-body techniques be used instead of certain medications such as certain painkillers or even ibuprofen?
So I never use instead. And that conversation, of using mind body session instead belongs with your doctor. 100% the doctors, may want to say, yes, we want you to lower your use, or, for example, you may have to wait before the next dose. And then definitely use your mind body session. But anytime there's a conversation about pain medicine, that needs to be safely done under the supervision of your doctors and nurses and nurse practitioners.
What is expressive art and how does it differ from art therapy?
So expressive art uses doodling, writing, journaling, and those kinds of things in more of a meditative sense, or self-reflective sense. And art therapy is a therapeutic modality that really helps process further trauma, emotional challenges, and is also a wonderful process done by a therapist.
You will maybe use expressive art as part of what you do.
Definitely, we use a lot of expressive arts, so creating cards, creating meaning and purpose, different projects that someone might want to do, patients want to do, a lot of doodling. Meditative doodling can be very relaxing, and it's helpful because it's something to do with your hand when you don't want to do, lay down and take a guided relaxation. You may want to do more movement-based. You can also do meditative walking. But I also think of expressive arts as creative gardening, gardening with the intention to relax, creative cooking, cooking created to share, and that's where I think the patients can customize their care. One patient loved bird watching, and that was her meditative space. And I consider that expressive art as well.
Have you ever had a situation where you've tried different techniques with a patient and they can't recognize themselves what's helping them, but you can actually see it taking place?
Yeah, yeah, and that came a lot of times with my work at the bedside, where I would see breathing would slow and I would see shoulders would soften, and so I could see the physical responses to relaxation. So sometimes it's hard to see because it feels like it's hard to feel because it might be such a small increment, but then practicing it and encouraging it to become a new habit is where the power is, and practice is really what it takes.
Can a caregiver or other family member attend a mind-body session?
Absolutely, and that's another thing that I think is very helpful, to have other people lovingly encourage you to use your practices, to use your guided imagery. Or sometimes what I'll do is show patients and caregivers the acupressure protocol, which is light touch using the tips of your fingers. And that is a really nice process because a caregiver can actually have something they feel like they can offer. And that's sometimes a really huge gift to a caregiver.
Is there a cost for patients to have a mind-body session with you?
No, no charge.
Beautiful.
Yeah.
What do you like most about being part of the Sandra and Malcolm Berman Cancer Center?
Oh, wow, what a great question. I really love my compassionate colleagues, and that is across the board. I work in office with amazing women. My direct boss is open to learning and really wants this program to rock and roll and get bigger, and just the compassionate care that I know my colleagues believe in, but also the courageous creativity that the patients, I really have a cool job and I get to remind them of what they have already. And just to see that flourish is really inspiring.
Lala, you've been doing this for a number of years now. I would imagine that over the course of those years, you've seen a lot of change in this area, a lot more acceptance, a lot more willingness to learn, a more immediate buy-in.
Yeah. Yeah, and that's exciting. That's really exciting. And I think that's only changing and getting better because the pandemic highlighted, for sure highlighted that we need resources like this. And that's where the power is when we all do what I call the collective compassion, take really good care of ourselves with that self-care and resilience, and then that just really extends out. It extends out. Once you're kind to yourself, you're kind to all the essential workers. You're more kind driving on 695, you know. So yeah, I
Yeah,
hope
we
this
could
is.
all use that. How
Yeah.
did you do during the pandemic? I mean, telemedicine must have been a godsend for you.
Telemedicine was amazing, amazing to it was hard to get used to and a huge learning curve, you know, but it to me it highlighted what we can do. It really highlighted what we can do when, you know, we want to still offer what we offer. And you know, more power to the patients who stuck with it when we couldn't get audio going and, you know, but we learned so much in that short time that hey, when we need to we can do something special. And the way I got through it, you know, some days it was hard coming through those doors where you knew it was dangerous or we didn't know a lot about anything. And it was that commitment, you know, that shared, we're going to do this, that really carried our team. Yeah.
Yeah, and you were talking of the team and actually how
Yeah.
this compassion can spread through the community. And I'm sure there are members of the community who may not be in need of your services right now, but would like to help you do what you do. And how
Yeah.
can people get involved?
So we're a new program, so absolutely we would be very grateful for donations. And like I said, this idea of educating ourselves in our own self-awareness, taking really good care to finally say that it's not selfish to have a self-care plan. You know, it's really making that commitment to educate ourselves, be open and willing to share our vulnerabilities in a way, and start to normalize reaching out for support rather than this idea of, you know, doing everything on our own and not, you know, having it as a badge of like not reaching out. You know, we have
Yeah.
to take care of each other.
How about for the survivors, the people who've been through their treatments, they're surviving.
Mhm.
Um, it, sometimes they, or many times, may like to revisit or come visit for the first time,
Yeah,
kind of some of these techniques.
right. And what's nice is I do 8 sessions. And then when we're finished with the 8 sessions, I leave it open to like a mind body check in. But sometimes when the survivor might have just started with me, that's kind of the same idea. We can do the 8 sessions, we can talk about the challenges that come up, but then when those sessions are finished, there's never a closed door on their mind body sessions. They can check in, um, even if they find one that they're like, hey, I'd really like your opinion on this one, and they want to run it by me. So the door stays open.
Before
Yeah.
we let you go, I just have to ask you, what is one favorite technique that all of us could do at home, anytime, to help us manage whatever worries or anxieties we may be feeling?
Oh, that's a really nice question. So I love the 3-minute breathing space. And so what that is, and it doesn't have to be 3 minutes, that's just kind of the guideline. So the first part of it is similar to the technique I mentioned before. The first part of it is notice what's going on. Okay, wow, I'm feeling overwhelmed or nervous to do an interview. And I can then say the next part is focus on your breath. Okay, so like I said, really tight focus on that breath. The sounds, the rise and fall of your chest, and that's the second minute. And the last one, and I always think of it as an hourglass, starts with what's present, gets a little tighter into breath sensations, and then the widens out to notice your whole body. And that's a really nice 3-minute breathing space that you can do before a meeting, in the evening when you come home, you want to leave, work, when you come in the door at home. It's a nice one that's very portable and easy to remember.
Sounds like 3 minutes well spent. Lolly
Yes.
Forsythe-Chisolm, thank you so much for being with us and talking about what it's like being a mind-body therapist at GBMC and what kinds of services you offer. We really appreciate it.
Oh, you're welcome. Thanks for having me.
And thank you for joining us for Ask the Oncology Expert. We'll see you next time.